The East, Central and Southern Africa Health Community has agreed on developing a system that will ensure a quick response to emerging and re-emerging diseases in the region.
Re-emerging diseases because these are the diseases which we are able to control them in the past, but they are coming back again because of environmental changes, because of systemic failure, because of other challenges.
The acting chief medical officer from Tanzania's Ministry of Health and Social Welfare gave an account of his country's first experience with the Rift Valley hemorrhagic fever about 10 years ago.
It gave us a lesson. What should we do if we are faced with similar epidemic? So the documentation of the experiences which we had that time, we are able to share with the member countries from ECSA.
While Tanzania has been able to contain the Rift Valley fever, Uganda has continued to have several outbreaks of Ebola and Marburg, which are a threat to neighboring member countries.
The nature of health problems, as you know, is that they do not respect borders. USAID is partnering with ECSA, Health Community, WHO, Ministries of Health, development partners to address cross-border health issues.
As a country, we have prepared guidelines to educating the public. We have prepared guidelines to educating the healthcare workers. We have developed emergency preparedness teams at all levels.
The ECSA Health Community in its 7th Best Practices for Health Conference has agreed on taking lessons from successful countries.
This region has a very high burden of malaria, HIV, AIDS, TB. We are also increasingly getting a high burden of non-communicable diseases like diabetes, hypertension, and this is within our own resource constraint situation.
We're looking at clinical, programmatic issues that are working in many different areas, and I think for us the biggest issue is that we know there's an awful lot out there that's evidence-based and that's working, but is not being scaled up.
She asserts that scaling this up will create a bigger impact on communities, especially the underserved. With prevention as top priority, member countries have agreed on finding strategies to enable them be prepared for these re-emerging and emerging diseases. Florence Nalimba, NTV.